First, we will discuss about the position of uterus. Between the vagina and the cervix is 90 degree, which is the acute angle, or we call it anteroverted. Okay, the second one is between the cervix and also the body of uterus. It is 170 degree, or we call it obtuse angle, or anteroflexion. Okay, and then next one, the dimension, we have the length is 3 centimeter, and then the width is 2 centimeter, and the thickness is 1 centimeter. Okay, this is uterus. This is the anterior part of the uterus. This is the posterior part of the uterus. How to identify the anterior and posterior? The anterior part, we will see the fallopian tube, and then the posterior part, we will see the ovary. Okay, and then the part of the uterus, there is 3, which is, first is the fundus, the second one is the body of uterus, and the third one is the cervix. The constriction between the body of uterus and the cervix, we call it isthmus. Okay, this is fallopian tube. There is 4 parts of fallopian tube, which is the intramural, isthmus, which is the narrowest part, the ampulla, which is the widest part, and also infundibulum, and end by fimbria. Okay, the junction between the body of uterus and also the fallopian tube is called corneal. Of uterus, first we have the round ligament, which is anterior to the fallopian tube. It is attached to the labia majora, and then the second one is the ovarian ligament. It is attached the ovary to the body of uterus, and then the third one is the suspensory ligament, attached the ovary to the pelvic wall. And next we have the broad ligament. Broad ligament have 3 parts. First part is the mesosalpinx, which cover the fallopian tube, and then the second one we have the mesobarium, which cover the ovary, and then the third one we have mesometrium, which attached to the body of uterus. Ligament of cervix, there is 4 pro-ligament of cervix. The anterior part, we have the pubocervical, which attached to the pubis. And the second one, we have posterior ligament, which is the uterosacral, attached to the sacrum. And then the 2 lateral ligament, which is the transverse cervical ligament, attached to the lateral part of the pelvic wall. Is supplied by the uterine artery coming from the anterior division of the internal iliac artery. The ovary is supplied by the ovarian artery coming from the abdominal aorta. The fallopian tube, the medial part is supplied by the uterine artery, and the lateral part is supplied by the ovarian artery. The venous drainage of the uterus is the uterine venous plexus. And then the fundus of the uterus is drained into the para-aortic lymph node. The body of the uterus is supplied by the external iliac lymph node, and the cervix is drained into the internal iliac lymph node. The cornea is drained into the superficial inguinal lymph node.